So, dear viewers, back again after this interesting introduction. We are so glad to have with us today Dr. Yasser Ghadanfar. He's a consultant clinical immunology and allergy. So, hello and good morning, doctor.
Good morning to you, Sarah. Good morning to you, Aziz, and to all to your viewer.
You're most welcome, and thank you for joining us today and this morning. Good morning, Kuwait. How was the cold of the studio?
It's very cold.
But you know what? We're going to warm up a little bit about our question. We're going to warming up.
Sure.
So are you ready, doctor?
I'm ready.
You're always ready, doctor, because during these days in the state of Kuwait, especially me and my co-host Sarah discussed about the humid and also a little bit dusty weather. Now it's changing from summer to autumn. How is this kind of weather affects also the respiratory system, you know, especially this kind of diseases, Dr. Yasser?
Okay. This is a very common question that we get, especially in this time of the year. When they're changing the weather, we're moving from one season to another season. We were very unfortunate this year. We have too much humidity. It's longer than usual. We also have too much sandstorms. And unfortunately, some of our patients have suffered a lot during this season. So the dust particle is well known to be an irritant. So once you inhale it through your nose, goes to your lung, and it can cause a lot of problems. A lot of our patients who do have chronic diseases like bronchial asthma, chronic obstructive lung disease, has unfortunately suffered during this season. We had, I mean, you're probably following social media, TVs, you guys been talking about trying to avoid this, but I mean, eventually it's not practical. I mean, people have to go out, they have to go to their work, they have to go pick up their kids from school. So it's unfortunate that they have to suffer through this. I can't tell you how many patients of asthmatic came this week because of the humidity over the last few days. So these are well-known triggers of allergies, triggers of respiratory diseases. And if you do already have some of these diseases, unfortunately, this is one of the inflammation that's causing the problem. They have the reason people come to the hospital.
And this is like the reason people come to the hospital because, especially Dr. Yasser, our distinguished guest said, a humid long time, more than 2 months, Sarah.
Yeah, exactly. We had a really long humidity in this summer, doctor. So now let's talk about the most common symptoms about the allergy patients. And we know it is really differ actually between each person and another. What are the most common symptoms, doctor?
Okay, so these are very common symptoms that, and it's very unusually for people. When they have itchiness of their eyes, itchiness in their nose, itchiness in the throat, itchiness in their ears. People who have allergies and they have suffered from allergies for a few years, they can tell you, and they can tell you their season. Listen, beginning of September, my season starts and it goes all the way up to, for example, March. Some of our patients have seasonal allergies and some of them have perennial allergies, meaning they have throughout the years. Now, since we were talking about the upper respiratory tract system, we're talking about the nose, the throat, the ears, it's also well connected to the lower respiratory system, so the lungs. So once you have inflammation in your upper respiratory tract and you have sinus problem, then eventually some of our patients also will have a lower respiratory problem. Then where you have the cough, when you have shortness of breath, and eventually some of them will have wheezing. At night they can't sleep, they wheeze, they have to rush to the emergency department to get their masks. So these are the common symptoms of allergies. It can differ between the age group. So for example, in young kids, cough is the most common one. In the older population, or the adults and older, it's mainly the itchiness part. You have to talk to these patients to tell you how much that's bothering their life. I mean, some of us maybe underestimate the effect of allergies in people. I mean, when your eye is itchy and you have a blurred vision, you can't focus on the screen, and we are glued to our phones and glued to our screen, and you can't do function that can definitely going to affect your function very well.
Exactly. So most of the Kuwaitis, they have those symptoms actually, Aziz.
Yeah, most of the people, because you know why? Because of the change of the weather, people get affected. So it goes me to another question, Dr. Yasser. We mentioned in the beginning, humid took a long time, like more than 2 months. We already suffered from humid, especially people who have asthma and the others. People who have allergy for a long period of time. Here they had allergy for this couple of months. They can suffer another disease like to transform from a disease to chronic. It comes for some kind.
I love your questions because that give me opportunity to talk about something what we call the allergy march. So we believe as an allergist, and that's proven by science, that if you started, for example, at a young age, if you're talking about 2 years old who have, for example, atopic dermatitis, or the people know it as an eczema, eventually some of these patients will develop food allergy. Some of them will develop allergic rhinitis like hay fever, allergies to pollen, and some of them will develop asthma. So we believe in that age group, if you can intervene with allergy medication or immunotherapy, you can actually stop that march. You can actually prevent allergy in that age group. So this is very important for parents to understand, for family to understand that if your kids had allergies, it's really important for you to take it to the specialist, trying to do the important tests to define these tests. And there is some intervention that's actually shown clinically and proven that's going to prevent this allergy march. So yes, if you intervene early, you can prevent some of these chronic diseases. Why bother of getting an asthma or getting a sinusitis and then you have to take treatment or hay fever and other complication if you can actually prevention. Prevention is always better than cure.
Prevention is better always than cure.
Indeed, Aziz. We know, doctor, some people, once they feel that they have allergy in their skin, in their nose, whatever, they start and run to the hospital to take cortisone. Is it really safe to take such a treatment, especially for children and pregnant women?
Okay, you just slapped me in my cheek with this question because this is really bothering me with the abuse of steroids of treating allergies. This is a very bad practice. This has been done for many, many years, not just in this country, in other countries too. People usually want the quick fix. And unfortunately, this is always a concept in their mind. I'm going to go and get that shot. They're going to keep me okay for 2, 3, 4 months. Not understanding that these treatments, specifically that you're talking about steroid, can have a long-term complications. People are underestimated because they say, I'm getting 1 injection, why you bother? It's not the number of injection, it's the amount of steroid that's been used. Some of them are used 100 milligram or 150 milligram, and if you take 2, for example, or 3, you're talking about a good amount of steroid that can have a massive effect in your body. You increase your risk of having diabetes, you increase risk of having osteoporosis, you increase your risk of having cataract. You also have a long list, I can go on and on, a long list of complications that can happen. That's only for people who take 1 injection. I know a patient who's been taking 3 or 4 injections per year because their season is the whole year around. So we really discourage people of treating their allergies with corticosteroid. This is not a good practice. All medical community around the world is against this. We have a lot of other new medication that's safe and it doesn't have the side effect of steroid that can replace this practice.
Yeah, so we have to try to avoid having cortisone as much as we can, and we'll talk later about the treatment. Yeah,
treatment comes later. Doctor, some people have misconception, allergy and sinusitis. Sometimes when you go in any houses, any places, I already suffer from sinusitis. The other said, no, I have allergy. What is the difference between them and also the symptoms? Because some people have misconception.
Okay, this is also a very good question. Sinus problems, it can be acute when you have symptoms for less than 4 weeks, and it can be chronic when you have symptoms more than 6 weeks or 3 months. Most people with acute sinusitis, they have the heaviness, the headache, they have the postnasal drips that they can feel. Some of them will have cough because of the drip. These people we usually treat it with antibiotic because it's usually the infection is a cause, virus or bacterial infection. Those who have allergies, seasonal allergy, perennial allergies, they have a chronic sinusitis. So this is really related to inflammation, and the treatment is totally different. These are the ones we use the allergy pill, we use the nasal spray that may contain some steroids. The symptoms is completely different. Now, when you talk about the sinusitis, people usually know when they're flaring because they have the headache is worse, the pain in their cheek, the heaviness when they move their heads, the postnasal drip. It's really different than just having the simple itching in your throat or your nose. So there is a quite distinction between the two symptoms.
So this is like the difference between the sinusitis and also allergy, Sarah.
Exactly. So doctor, now let's move on with the influenza vaccination. I know a lot of people, they have like each in a year or once in a year the vaccination against influenza. A seasonal influenza. So is it really good, actually, or it's really safe to have such a vaccination, and it's really conflict with those who had the coronavirus vaccination?
This is also a great question. So 2 years after COVID-19, and I think we learned a lot from vaccination with the COVID. Now, for the first time, we actually diagnose patients who have both. You can have COVID-19 virus and you can have flu vaccines.
Yes.
And we know for sure that these people usually have worse symptoms. and some of them may ended up having a more complication requiring hospitalization or admission to the intensive care unit, and some of them unfortunately can lead to death. So it's very important, the same lessons we learned from the COVID, to apply it. We know flu even many, many years ago.
Yes.
Now, to convince people to take in their flu vaccine, you need to tell them two things. You need to tell them it's very effective and how it's effective, and you need to tell them it's safe. So just for your viewers, how effective is this treatment? They are very effective. It's not 100%. There's nothing 100% in the world, but it's around 80% effectiveness.
Oh, huge, actually.
Yeah,
huge rate.
that's a huge number. We tell people that in general population, if you take your flu vaccine, you prevent them from going to the hospital more than 60%. You prevent them to going to intensive care unit more than 80%. You prevent death in certain group more than 30%. If you talk about special group, people who are above 65, pregnant ladies that can have complication flu vaccine. If you give them the flu vaccine, you actually can prevent complication in these two groups. So it's a very effective treatment. Now, one of the things I think people realize more with the COVID is how we develop our vaccine. So people realize that COVID started in China and Wuhan, move up to Europe, it moved up to Middle East, and eventually went to North America. That's exactly the same route of the flus many, many years ago. So we actually had people on site in South Asian monitor the strain of the flu vaccines, taking swabs from people, knowing which strain is predominantly this year. Then the company will develop their flu vaccine, so by the time it comes to us now in October, we know which strain has been going on for a few months. So it's a very effective, and it's a dynamic thing. It's change every year. So we know the strain is predominantly over the last few months, and that's why we're bringing the vaccine in October. You take it in October to be effective in January, we have most of the cases. The second part is safety, which a lot of people has questioning the safety of the flu vaccine. It's in general very safe. You rarely see any complication. The number of complications they're seeing is very few. Again, we not ever say it's 100%, but I think we always say risk and benefit. The benefit of taking the flu vaccine is outweigh much the risk of having any complication. The problem now with the social media, people focus on 1 or 2 cases they heard maybe in the country or other country, and that goes around, so, oh, this is not a safe vaccine.
You know, you mentioned something important, Doctor. I want to point more pin about this topic, because social media is also, we call it rumors, spreading a lot. You know why? Because in Kuwait we said the good thing it becomes small and the bad thing is spreading all the time. And you, because you're specialized in the immunology, and now is the time, because we mentioned before, prevention is better than cure. You and your responsibility as you're specialized in this field, how is it important as you and also your colleagues spreading awareness, giving advice to the public, especially in the media, on TV, and even your account in social media?
I think you're talking about, we live in a country where 90% of the population carry a smartphone. Social media is part of us. So phones is with everybody. It's different ages, different ethnicity. Everybody has a smartphone. So I think social media is very important. Now it comes to the one, how you're going to spread it and the language you're going to spread it. Having it in Arabic only, that's not going to be enough. Arabic and English is also not going to be enough. There's certain people using different platforms. I think it's very important to use this. We can easily, as a community or as an institution, as a Ministry of Health, sponsor some of these ads. It's going to make a difference. I mean, we always see when we make these campaigns in the Avenues Mall or in other media, we see how many people...
Any places, any gathering point.
Any gathering point that can see that the number of those who attended these campaigns are very good and well receptive. But I think we need to always keep this in mind. It's depending on the campaign for the flu. We always this time of the year before October, where we tell people you need to go and get your flu vaccine, so take a couple of weeks or 4 weeks to kick in, so you'll be ready for the flu season.
Exactly.
So everyone already is ready now, Sarah.
Is ready now, and now we are ready to ask this important question. What are the most important food and vitamins that really enhance our body immune system against allergy diseases, actually, Doctor?
Okay, that's a very good question. So I think during the COVID, you have received so many messages through medias and about using different vitamins, different food. The science is very diverse and conflict on this. I know personally, like a lot of pharmacy run of vitamin C's and other vitamins during the COVID.
You will see the too many medicines at the capsules also.
And I think a lot of people also order their multivitamin through apps and online.
Some people are addicted actually to vitamins, multivitamins capsules.
Yeah. My answer may not be liked by so many viewers because it comes basically to two things. Healthy diet and exercise.
Nice.
When I mention healthy diet that's rich in antioxidants, diet that's rich in omega-3. Omega-3, for example, is rich in red meats like fish, like salmon and other. It's also available in other things. I tell people, instead of taking your omega-3 every day, if you have a seafood meal once a week, that's going to replace you from any vitamin you're going to take. Now, we know for sure that there's certain vitamins important for the immune system. Vitamin D, I mean, a lot of people talk about vitamin Ds. The problem that we face with the community, they only comes once a year to take their vitamin D level in the blood, and if it's low, they take the pills for a few weeks, and they think they're going to be good for the rest of the year. That's absolutely not the case.
Yes.
It's like the shelf and when you go to the supermarket. It has to be stocked all the time. So you fill your store in the beginning, but you also need to maintain it. And I tell people, usually your body requires 1,000 international units of vitamin D. Nice. It can be supplied by the food. It not necessarily has to be the supplement. The problem, we eat a lot of food, but it doesn't contain a lot of these vitamins. So sometimes you need to replace it with multivitamin. But for example, vitamin D, there's a misconception vitamin D is available in the dairy product. It's not in the dairy product. Dairy product has calcium, but doesn't have vitamins. So you need to read about some of the things. But again, it comes to the point that you need to do good health and exercise. Exercise has shown to improve your strengthening. A lot of people have been using intermittent fasting as a way of getting their immune system.
Yes.
It's actually well studies. It's been studies in different areas in the world. They actually telling people who come in to get their chemotherapy in certain countries, in France, United States, to fast 6 hours or 8 hours before the chemotherapy because they actually enhance your immune system.
Immune
It's also
system,
shown practice.
and also to be better, to be stronger, to be strong your immune system. Doctor, we see all the times like good times run very fast. We didn't fill the time. We appreciate your efforts. We thank you to come here, approaching, to share to the viewers watching us through the KTV2 about how to enhance our immune system, and also sharing with them about the allergies and how to avoid. Thank you for sharing awareness.
It was my pleasure, and thanks for the invitation.
Thank you, Dr. Yasser. Thanks and big appreciation to our guest, Dr. Yasser Ghadanfar. So now, dear viewers, we have this report. Let's watch it together and then we'll move on with our episodes.